Good evening again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk with you a little while this afternoon by a patient I had. This is the only one I ever did this on, was an oversized tongue, and we had an ENT man reduce the tongue similar to what Dr. Andre Petit, the oral surgeon from France, came over to Baylor and did several of these in a 2 to 3 year period of time here, and I heard his lectures and it really worked, so I was wanted to try it and do it on several patients, but nobody accepted it except this young man and his family, and I showed them what they needed to do, and they said, well, let's go ahead and do it. So we did that, and he had two pretty badly impacted upper cuspids that we needed to work with first and get them in line before we did this. So let's get started on the case here. It shouldn't take us very long, but there's a lot of pictures here, but I never did get the pictures of the finished thing, so you just have to take my word for that. Here, let me get this case going. I thought I had him rigged up here. Hold just a minute. Okay. This he had a lot of pimples on his face, and he was a swimmer and did a lot of swimming and everything, and he had this sprawled out teeth. His upper teeth were spread out, and the lower teeth, and they just never could get them to come together at all. So there's something wrong in here. This young man just had a huge tongue, and then he had two badly impacted cuspids up there that I felt I had to get them down in place before we did the other, or tried to do the other procedure. I had a hard time getting the ENT man to do this job, but he finally did. Let me go back on that. You can see everything sprawled out like that, and I could never get his teeth to come together. They just spread back out again, and so it was obvious that this was a case where we had an oversized tongue, and I had seen this, the operations that Dr. Andre Petit had done on people where their teeth were just flared way out like this, and he reduced the tongue, and with nothing else, the teeth came back down on these people. So anyway, I knew this worked as far as that was concerned, and so I wanted to really go ahead with that. And you can see now this, I think, was the first Panorex we took of his teeth, and you can see these impacted cuspids up in here, right in this area right here, and we're going to have to open this gap quite big, and we'll do that, and you can see, and we'll direct them down in place before we get on with the rest of the work. So let's go here. Here we go. The cuspids, and we took out the deciduous cuspids, and we sent him to an oral surgeon now to do this work, and he made one little mistake here that I want to point out to you when we look straight at the places where the impacted cuspids were. Now, if you're not familiar with taking, you don't want to take any tissue off the labial side of an impaction like that, but you can take tissue in the palate and do a lot more than you really need. Now, oral surgeons, they just completely expose the tooth down there. I never did do that. I was if I did it, I just did a little bit around like that and cauterized this and bonded a hook on the tooth. But the oral surgeons, they would expose it like this, but not exactly. Now, when you're cutting this tissue next to a tooth, don't go up and hit the tooth and then go over and come down like they did here. And they left a space in there. And this will always create a pocket around that tooth. So you can watch this tooth as we go through that, and that's one of the things I wanted to point out on impactions. When you open up the cuspid, don't run into the tissue around the teeth. Leave this tissue there if you possibly can, because it's hard to get this to come across and without developing a slight pocket in that area. So that was a thing I wanted to show you in this impaction deal. But this was back from the oral surgeons, and we opened the gap with the spring, and we had elastics. This was not our really good spring method of taking these in. We used elastics, pulling them down, and then we came in with other deals and pulled them to the side, and we had elastics coming down, pulling the teeth in. We didn't have any problem getting the teeth in there, and the tissue healed back up, as I'll show you in there. So the teeth, we pulled them on across, and you can see we tied elastic. Now the patient has to put these on, and that's one of the problems. A lot of times when we use a spray coming out of here, we'll make a little deal go down something like this and around here, and then come back up, and we'll run this dental floss in and use it with a spring from back here, which is something that the patient doesn't have to mess with. The patient has to put these elastics in there and keep them there that way, and you have to change them every day anyway, or maybe twice a day. All right. Anyway, we're going with it, and the teeth are coming across, and you see this place is not healing up good. This is doing good and filled in around here in that area. So if you uncover your own teeth, don't cut it up next to the tooth. Leave some tissue between you and the tooth in that area. So here we're pulling that on in, and I'm going to run through this pretty quick. Most of this is just regular orthodontics, getting the teeth in place. And so we got them down in place, and everything is going good. And this did not heal up. You see the difference in this and this. So this is the point that I want to bring out as far as uncovering the teeth. If you do it, do not cut around like this. Cut and open it up this way, and leave some tissue next to the tooth itself if you uncover them. So we'll go ahead. Now this is going okay, coming on down, and we'll get the teeth in there, and I'll have to turn them around and rotate them. And we still had, we've got the teeth in place now and got them rotated correctly, and the tongue, it's just a huge tongue, way over like this. And I realized I could not close this space and get it to stay, even if I pulled it together and kept bringing them forward for the tongue. I just could not close those spaces up. And so I talked to the ENT guy, and he tried to figure out what Dr. Andre Petit did and how he did it, and he talked to the old surgeon in Dallas that worked with Dr. Andre Petit, and how he picked out how much he would take off and all this. And so he did the operation on the tongue. And they take a tremendous piece of the tongue out. I mean, it's a piece about 1 inch wide and about 3 inches long, but you do it right down the middle of the tongue and come on out and pull that together, and the taste buds are in the side of the tongue and everything, and people really don't notice that the tongue is gone that much. They don't get the problem with the taste buds or anything. So Excuse me. So here we go after that, and I send him in and got the tongue done. Now I think the tongue has been operated on now, and you just see this little place go right down the center of it, but it's still a big tongue. And I talked to the ENT guy who did it, and he said, after I got through with it, I thought, well, I didn't get enough of it. And yet he cut an inch-wide strip right out the middle of the tongue, about 3 inches long, going back to the back, pull it together, and you get your taste buds and everything come up on the sides, and the tongue of it didn't, the tip of it didn't seem to bother that. So here it is. After it's done, it still looks, it must be a little swollen up because it looks god awful big here at this point. But anyway, we got the tongue reduced, and we were able to pull the teeth together and line them up, and they stayed there. I don't have finishing pictures on this young man. I don't know what happened to them, but I thought the story, I should tell you about it. It's the only case that I ever did, but it's not the only case that I should have done. But nobody accepted this treatment, and I can blame them. They just went somewhere else when I suggested this is the possibility of doing that. But I saw the patient, the Dr. Petit did, and their teeth were flared out like this, and it reduced the tongue, and without anything else, and the teeth came together like that. So anyway, that's, you'd have to take it for what it's worth there. That's, I don't have any proof of it at all. And here's the way the tongue, it looked a little pointed after we got through with the operation and everything. And that's finishes this video. I hope you get something from it. And whether you ever do one of these or not, if you get somebody that just can't close a space on the in between the teeth. Now I had another lady who would not do in other words, I couldn't close the space, but I didn't want to because her face was already flat. And so I just put 4 extra bicuspids in on that lady, and so you can come out that way on the situation. Now I felt like if I added teeth to this young man, he'd be too full in the face. So it was better to go in and do the tongue operation. Thank you for watching, and if this ever comes up in your practice or you see it, you'll know something about this. Try to look it up on the computer, and I can't find anywhere that Dr. Andre Petit came over here for a couple of years and worked at Baylor Dental School. When he did that, he spoke in Chicago, and I listened, went up to Chicago to hear him. And he did a marvelous job with tongue reduction, but it's a pretty gory procedure. So I'm going to close out and say good evening and sign off here.